Okay, before I start, okay, due to risk in a possible way for, please do not have any gatherings above 5 people, you know. And this is from a doctor, Dr. Peter Gini and other doctors. So, anyways, today's coronavirus case is 411. It's coronavirus day 454. Okay, phase 1 is starting on Friday. 2 days later. Yeah. Okay. So 97 cases are from Toronto, 72 is from PORCUPINE Region, 35 is from Waterloo Region, 26 is from York Region, and 25 is from Hamilton. All other regions are reported under 25. So, so 33 deaths have been reported. Okay. So variant cases. Of course. So the UK alpha is at 134,608. Now with an increase of plus 902. South African variant beta is at 1,125. Right now, an increase of plus 28. So Brazilian variant Gamma is at 4,073, an increase of 64. And the UK variant, the last number was given was 97 in PORCUPINE Region because there's no new update. However, it's in the rest of Ontario now, but I'll get to that. So I'm in last video I mentioned how it's in every single region in Ontario. So that's trouble. So yeah, and the government has not done much with screening because not all apparently screening places, labs have screening technology, so that can detect Indian variant. So that sucks. So vaccines, you can sign up for vaccines down, details are down below. I don't have to tell you, you probably should know by now. So they also have the phase 1, 2, 3 rules down below too. Okay. So I want to talk about the India variant, the India double-mutant variant, or the nickname Delta variant. But I prefer India variant because because the nickname thing is I think it's overrated. So Dr. Lawrence Lowe, the medical officer of health for PORCUPINE, said even though infections have dropped in the virus hotspot in PORCUPINE to the Delta. So the India variant could cause a resurgence, which is bad news. Oh god. So scientific evidence shows people with the one vaccine, though the last protected against the highly infectious India, the double-mutant variant, which is poised to become dominant in PORCUPINE region this month, and so the India, the Delta variant, it's gonna take over the UK variant spot and become take the #1 spot right now. Dr. Lawrence Lowe said said that people should continue to limit their contact with people outside, follow public health measures, and do not have large gatherings when restrictions loosen. So when Friday starts, of course, there's going to be like 10 people like maximum outside, but there are going to but he knows that there's going to be people breaking the rules. If people don't break the rules, then play it safe. Following restrictions. So there were like things will be better. Things will be better. And as he quoted, it's not time to fully start to celebrate. We must continue to emerge gradually in the lives that are reopening because patio dining, limited retail shopping, and outdoor gatherings that are up to 10 people will be permitted on starting Friday, along with the other mostly outdoor activities. Also exercises too. And though they urged people to get vaccinated as soon as possible and get their second doses when eligible. There is you could get your second vaccine shot, and if everyone gets it first, get their first shot already, and then those who are eligible. So the 80 plus were they already and then it's the 70 plus right now. Who knows? I think it might be the 65 plus right now, and then 50 plus. Yeah. So Dr. Eileen de Villa, the Toronto's top medical doctor of health. She said the province's reopening must happen gradually because if we just don't open it you can do this, you can do we can just open everything. She said we should open gradually because of the India variant. So she's also concerned about that one. And some parts of Toronto are affected. So the India variant as a part have affected some neighborhoods. I'm not and that's troublesome. And of course, Toronto would be a target. And she's watching what's going to happen in Toronto, and if things get worse, regulations. So she reported there's 122 cases in Toronto currently. So there was a second case in Porcupine County, but there was no number given. in North. So the Porcupine County, the Porcupine Health Unit in charge of the Porcupine health, county region. They won't be opening on a Friday, so they're going to be the only ones being pushed back. So they're still going to be like they won't be entering stage 1 just yet. So unfortunately, So the Porcupine Health Unit, they said, I know it's unfortunate, but it's because of the India variant. And it's much more easier, it spreads more easier than, the UK variant, and more transmissible as mentioned, and can affect people a lot more. And they also mentioned it's affecting our community, and it's important that everyone follows the public health health measures that are diligently, and limit contact with others who we do not live with. So that is something that we have been hearing for like every single health unit in every single region. So we need to like limit those. So for them in Porcupine County health unit, anyone 16 and older could book their second coronavirus vaccine after 28 days. The 4 weeks. Citing the need for increased protection against the India variant. So another thing I want to talk about, and this, and I was actually hoping for this one too. So the in-vehicle road tests are to resume in Ontario starting Monday. So it's not going to start Friday. It's going to start Monday. So in-vehicle road tests are set to resume on Monday. So Transportation Minister Caroline Mulroney, she first tweeted the news this week. So this move allows for the resumption of the G2, G, and motorcycle M2 and M tests, according to the Drive Test website. Don't looking to book a new appointment at the Drive Test location, you can do so online. So a spokesperson for the Ministry of Transportation said driving tests have been cancelled throughout the province a few times during the pandemic. Of course, through April when the stay-at-home order was the second one was implemented. So all in-vehicle passenger road test will resume with the restrictions with enter the step 1 starting Monday, not Friday, Monday. So this is through high demand. So drive test centers that will remain open for inside services such as like knowledge tests, like the written test, so like G1, now that. others but with capacity restrictions and other coronavirus measures. Prevention officials. The government is officials said they're investing more than 16 million to increase road testing capacity due to progress to address the backlog caused by COVID-19. So that's good news. So the funding, they said, will include hirings 167 temporary examiners, expanding testing hours, increasing support staff, and implementing weekend testing where demand is highest. And 6 temporary drive test locations will be opened in the greater Golden Horseshoe starting in September. So the government said these measures are also in addition of 84 temporary examiners announced that last fall. I've been waiting to get my G2 license by doing the road test, and I couldn't because of coronavirus stopping me from doing it. So that was the only thing that was stopping me from doing it. So I'm actually happy about this. So we just need to be careful of the India variant. That's going to be the new high variant, and our new biggest threat. And 122 in Toronto. That's actually the second highest in Canada that I have heard of. It tops Ottawa's number 1. It's right below Ottawa, 141 deaths, and of course, and Peel Region's at 97. And British Columbia and also there was a 36 somewhere. So just remember that officers can break up gatherings over 5. You know the fines. I don't have to explain it. You should know it. It's about $750 per person. No, 880 for to ride checks. 1,000 for preventing others from following orders. 10,000 for those who organize and plan the gathering. Then 1 million if severe, and possibly jail time. So hospitalizations. It has somewhat lowered to 571 people hospitalized, minus 50. So 390 patients are in ICU. Okay, minus 7, and 314 ICU patients are using a ventilator, plus 9. So this is better than April and May results going lower. So long-term care home death has surprisingly increased to 3,780. So that's plus 3 since June 6th number, which was unchanged until June 9th, 3 days later, and staff death has not changed, still at 13, and 19 deaths are the outbreaks right now, which is like a -1 from the last day. So please follow coronavirus safety rules and regulations, and alter rule only for tomorrow, and then and also phase 1 rules and when they start on Friday. Please do not have gatherings over 5, and starting Friday, do not have any gatherings over 10 outside. Officers have every reason and have 100% right to stop you. Stop any gatherings and disperse them. So sign up for vaccination. Like if you're second vaccination, that's a requirement for the phase 2. We need to have like 70% of Ontarians vaccinated, getting their first shot, and then to get to phase 3. So it depends per region. Rated by the local health unit, and also to phase 3 is 80%. From what I stay safe. Sign up for your vaccines. The website sort of changed. I've noticed. So there's the 2 options. You can sign up for your first vaccine shot or your second vaccine shot. So it depends on who you are. Like, if you haven't gotten your vaccine shot yet. Stay safe.